Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and the topic is proximal anatomical term of direction. If you are following the series, so you must know we have already covered various other topics related to anatomical terms of direction. So this session is in the continuation of the same, where we are going to talk about the proximal anatomical term of direction. I'll tell you what is proximal anatomical term of direction, how it is different from the other terms that we have already discussed related to direction, and also we will see some of the best example that will help us to understand this concept properly. At the end, I will give you one trick to remember this content, like how you will recall it during your interviews and exam, and also I'll share you some pointers and questions that will help you to understand the things properly, and that you can refer for your exam or interview preparation. Clear? But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on proximal, right? But prior to that we have already covered so many other types, so you should know about them. Okay, and for that you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So according to your language preference, you can easily consume the content. And in case if you want to ask any questions related to that, you can simply reach out to me through comment section. I would be more than happy to answer all your questions there. Okay. All right. So let's get started, and we'll start with the definition itself. So here you can see, I'll just show you. The definition is very simple and straightforward. Proximal means closer to the point of origin, closer to the point of attachment, or closer to the trunk of the body. Clear? So these three statements will help us to understand what is proximal. Proximal means closer to the point of origin, closer to the point of attachment, or closer to the point of trunk of the body. Clear? So in simple words, you can say that any structure or any body part that is nearer to the where a limb connects to the body is called proximal. Okay, so any structure or a body part that is nearer to the near to where a limb connects to the body is called proximal. For example, proximal is something closer to the origin, closer to the trunk, and closer to the point of attachment. Now to understand this properly, think of a body like a tree. Okay, so we will compare the human body with a tree. Now the trunk of the tree, the trunk of the body is chest and abdomen. Okay, so compare the trunk of the tree with the trunk of the human body, that is chest and abdomen. Branches are the limbs. Okay, so arms, legs, these are the branches. The part of the branch closer to the trunk is called proximal, and the part of the branch farthest from the trunk is distal. Clear? So if we compare the human body with tree, then the structure that is closest to the trunk is called proximal, and the structure or the branch, the part of the branch farther from the trunk is distal. Okay, so you can say the shoulder is proximal to the elbow because the shoulder is closer to the trunk of the human body than the elbow is. Clear? So the one which is closer to the human body, you can say trunk, for example, so is called proximal, and the thing that is on the farthest from there, so it will be called as distal. That I'll explain in next session because it's opposite word. But I think now you have idea what is proximal, and it is mostly related to limbs. I'll tell you. So one thing is clear, that the opposite of proximal is distal. Proximal is closer to the trunk origin, distal is farthest from the trunk origin. These two always work as a pair. You cannot understand one without knowing the other one. Example is the shoulder is proximal to the elbow. So which one is closer to the trunk, or you can say chest or abdomen? So if we look at the shoulder is nearer, right? Not the elbow. That's why we are saying shoulder is proximal to the elbow. Similarly, fingers are distal to the wrist. If we compare wrist, so wrist is fingers are distal from the wrist. Clear? So most importantly, we can say that proximal and distal are primarily used to describe the structure of limbs, that is arms and legs, and tubular structure like blood vessel, nerves, and the digestive tract. Clear? Alright. So now you can see, unlike the other directional term that apply to the entire body, proximal and distal are most commonly and most correctly used when describing upper limbs like shoulder, arm, elbow, forearm, wrist, hands, and fingers. Similarly, for lower limb like hip, thigh, knee, lower leg, ankle, foot, toes. Blood vessel like arteries and veins, nerves like nerves, trunks, and branches, digestive tract from mouth to anus, urinary tract like kidneys to urethra, bones ending of the long bones. So these are the all example that comes under a proximal and distal. Like mostly we use proximal distal for these things. Now if we compare it with example, so here I have noted down some simple sentence with their meaning. The meaning will help you to understand the things properly. So the shoulder is proximal to the elbow. That means the shoulder is closer to the trunk than the elbow. The elbow is proximal to the wrist. The elbow is closer to the trunk than the wrist. The wrist is proximal to the fingers. The wrist is closer to the trunk than the fingers. The hip is proximal to the knee. The hip is closer to the trunk than the knee. Okay, so I think now you have understanding of how it is used in examples or in a simple sentence. Now let's see how it is utilized in medical coding. So in medical coding, ICD terms CM and CPT, the word proximal appears very frequently, like proximal humerus fracture, that is fracture at the upper end of the arm bone near the shoulder. Proximal femur fracture, that is fracture at the upper end of the thigh bone near the hip, includes the hip fracture. Proximal tibia fracture, that is a fracture at the upper end of the shin bone near the knee. So these are all terminology, but these are not only the terminology, there are other terminology as well, which we frequently use in order to show something related to proximal and distal, okay, in medical coding. Now we have learned about this concept, right? But if you want to remember it for later, what are the tricks, how you can recall it during the interviews and exam? So in the word proximal, P is there, okay? So P for proximity, that is closer, near to the trunk. Now think of this like way. Proximal is near the core of the body, like trunk or origin. Distance means far from the core towards fingertips and toes. Now another easy way to remember is proximal is closer to where the limb begins at the trunk. Distal is closer to the where limb ends at the fingertips or toes. Or now to relate it with the river, the source of the river, that is origin, is called proximal. The mouth of the river, distal, far end is the distal. Okay, so water flows from proximal to distal, just like a blood flows from proximal aorta distally into the smaller vessel. So these are the all things that will help you to understand or recall the things in interviews and exam. Okay, now as usual, there is one question for all of you, and today's question is, what is the meaning of supralateral? I'm sure you already know about the answer of this question, but in case if you don't know, what you can do, you can simply refer the previously released session first, because there I have already discussed this thing in detail. And once from there, like once you have clarity on the answer, then you can share your knowledge in the comment section. But I strongly recommend you to please do share your knowledge in the comment section, because once I started receiving the answers in the comment, it will indicate me that you guys are learning from these sessions, and accordingly I will release the other recorded session that I have already prepared for the medical coding series. Okay, so and also your answer will help others to understand the answers, like what will happen, like if they don't know about this answer, so they can simply watch the they can simply look at the comment section, otherwise they are supposed to search it on web. So your expertise can help someone, so please do share your knowledge in the comment section. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.